Anesthesia in Patients with Comorbidity. A comprehensive overview. Prepared for educational purposes. Introduction. Anesthesia in patients with coexisting diseases refers to the practice of administering anesthesia to patients who have pre-existing medical conditions, comorbidities, that may impact their physiological response to anesthesia, perioperative management, and surgical outcomes. These conditions can include cardiovascular diseases, e.g., hypertension, coronary artery disease. Respiratory diseases, e.g., COPD, asthma. Metabolic disorders, e.g., diabetes, obesity. Renal and hepatic dysfunction, neurological disorders, and hematological conditions. Impact on perioperative management. 1. Increased perioperative risk, higher morbidity and mortality. 2. Altered anesthetic drug response, pharmacokinetics and dynamics. 3. Cardiovascular instability, hypertension, arrhythmias, ischemia. 4. Respiratory complications, hypoxia, bronchospasm, respiratory failure. 5. Impaired wound healing, diabetes, malnutrition, immunosuppression. 6. Increased risk of infections, immunocompromised states. 7. Renal dysfunction, fluid overload, electrolyte imbalance. 8. Hepatic impairment, altered drug metabolism, coagulopathy. 9. Difficult airway management, obesity, obstructive sleep apnea. 10. Higher risk of thromboembolism, immobility, hypercoagulable states. 11. Operative complications, delayed recovery, ICU admission. Importance of risk assessment in anesthesia for patients with coexisting diseases. Identifies high-risk conditions and potential complications. Guides selection of anesthesia type and drugs. Helps determine the need for advanced monitoring. Ensures preoperative stabilization of chronic diseases. Reduces perioperative risks and improves outcomes. Prevents intraoperative hemodynamic instability. Minimizes postoperative complications. Supports multidisciplinary decision-making. Enhances coordination between surgical and anesthesia teams. Identifies patients needing ICU care or extended monitoring. Aids in planning pain management and early rehabilitation. Common coexisting diseases. Hypertension, diabetes mellitus, asthma and COPD, coronary artery disease, chronic kidney disease, liver disease, obesity, pregnancy with complications. Risks to anesthesia. 1. Delayed recovery from anesthesia. 2. Increased perioperative morbidity and mortality. 3. Hemodynamic instability. 4. Pulmonary complications. 5. Metabolic derangements. Hypertension and anesthesia. Risks and management. Risks. Preoperative risks. Stroke, myocardial infarction, difficult blood pressure control. Intraoperative risks. Hypotension or hypertension, arrhythmias, myocardial ischemia. Postoperative risks. Hypertensive crisis, delayed recovery, increased risk of bleeding. Management. Preoperative. Optimize BP control, continue most antihypertensives, avoid abrupt withdrawal. Intraoperative. Maintain stable BP, use appropriate anesthesia, monitor closely. Postoperative. Resume antihypertensives, ensure good pain control, prevent BP spikes. Diabetes mellitus and anesthesia. Risks. Preoperative risks. Poor glycemic control, increased infection risk, delayed wound healing. Intraoperative risks. Hypoglycemia, hyperglycemia, ketoacidosis, electrolyte imbalances. Postoperative risks. Delayed recovery, wound infections, cardiovascular complications. Management. Preoperative. Optimize blood glucose, adjust medications, hold or modify insulin, oral drugs, check HbA1c. Intraoperative. Monitor blood glucose regularly, use IV insulin if needed, maintain fluid and electrolyte balance. Postoperative. Resume diabetic medications, prevent infections, ensure good pain control and early mobilization. Asthma and COPD and anesthesia. Risks. Preoperative risks. Poor lung function, increased mucus production, airway hyperreactivity. Intraoperative risks. Bronchospasm, hypoxia, hypercarbia, prolonged ventilation. Postoperative risks. Respiratory failure, atelectasis, pneumonia, delayed extubation. Management. Preoperative. Optimize lung function, bronchodilators, steroids if needed, assess severity, spirometry, ABG. Intraoperative. Use regional anesthesia if possible, avoid airway irritation, provide adequate oxygenation and ventilation. Postoperative. Monitor closely for respiratory distress, encourage deep breathing exercises, optimize pain control to prevent hypoventilation. Coronary artery disease (CAD) and anesthesia. Risks. Preoperative risks. Myocardial ischemia, infarction, arrhythmias, heart failure. Intraoperative risks. Hypotension or hypertension, tachycardia, reduced coronary perfusion. Postoperative risks. Myocardial infarction, arrhythmias, thromboembolism, hemodynamic instability. Management. Preoperative. Optimize cardiac function, continue beta blockers, statins, assess risk, ECG, stress test, echocardiography. Intraoperative. Maintain stable hemodynamics, avoid tachycardia, hypotension, use balanced anesthesia, ensure adequate oxygenation. Postoperative. Monitor for ischemic changes, control pain and BP, encourage early mobilization, prevent thromboembolism. Chronic kidney disease, CKD, and anesthesia. Risks. Preoperative risks. Electrolyte imbalances, hyperkalemia, anemia, fluid overload, metabolic acidosis. Intraoperative risks. Hypotension, impaired drug clearance, increased bleeding risk, pulmonary edema. Postoperative risks. Delayed drug elimination, worsening renal function, infection risk, fluid imbalance. Management. Preoperative. Optimize fluid and electrolyte balance, assess renal function, creatinine, eGFR, manage anemia, adjust nephrotoxic drugs. Intraoperative. Avoid nephrotoxic agents, monitor fluids carefully, maintain stable BP, consider regional anesthesia if feasible. Postoperative. Monitor renal function, avoid fluid overload, adjust medication doses, prevent infections and electrolyte disturbances. Liver disease and anesthesia. Risks. Preoperative risks. Impaired drug metabolism, coagulopathy, ascites, encephalopathy, variceal bleeding. Intraoperative risks. Hypotension, bleeding tendency, fluid overload, sensitivity to anesthetic drugs. Postoperative risks. Delayed drug clearance, worsened liver function, infection risk, hepatic encephalopathy. Management. Preoperative. Assess liver function, LFTs, INR, albumin, correct coagulopathy, optimize fluid status, manage encephalopathy. Intraoperative. Use liver-friendly anesthetics, avoid excessive sedation, monitor hemodynamics closely, maintain normavolemia. Postoperative. Monitor liver function, prevent infections, adjust drug dose, provide nutritional support, avoid hepatotoxic medications. Obesity and anesthesia. Risks. Preoperative risks. Difficult airway, obstructive sleep apnea, OSA, cardiovascular disease, diabetes. Intraoperative risks. Difficult intubation, increased aspiration risk, poor ventilation, hemodynamic instability. Postoperative risks. Respiratory depression, hypoxia, deep vein thrombosis, DVT, delayed recovery. Management. Preoperative. Assess airway, screen for OSA, optimize comorbid conditions, consider prophylaxis. Intraoperative. Use appropriate airway management techniques, position carefully, optimize ventilation, monitor hemodynamics closely. Postoperative. Ensure adequate oxygenation, encourage early mobilization, provide DVT prophylaxis, use multimodal pain management. Pregnancy with coexisting diseases and anesthesia. Risks. Preoperative risks. Increased risk of maternal and fetal complications, altered drug metabolism, hemodynamic instability. Intraoperative risks. Difficult airway, aspiration risk, hypertension, fetal distress, bleeding. Postoperative risks. Delayed recovery, increased risk of thromboembolism, infection, poor wound healing. Management. Preoperative. Optimize maternal condition, assess fetal well-being, adjust medications safe for pregnancy. Intraoperative. Use pregnancy-safe anesthetics, maintain uteroplacental perfusion, monitor both mother and fetus. Postoperative. Provide adequate pain control, prevent thromboembolism, ensure maternal and neonatal monitoring. Preoperative assessment. 1. Patient history, medical conditions, previous surgeries, allergies, medications. 2. Physical examination, airway, cardiovascular, respiratory, BMI, neurological status. 3. Laboratory and imaging, CBC, electrolytes, renal liver function, ECG, chest X-ray if needed. 4. Risk stratification, ASA classification, difficult airway screening, anesthesia risks. 5. Medication view. Adjust chronic medications e.g., antihypertensives, anticoagulants, insulin. 6. Fasting guidelines. Ensure proper NPO status to prevent aspiration. 7. Informed consent. Discuss anesthesia plan, risks, benefits, and alternatives. 8. Optimization. Manage underlying conditions, consult specialists if necessary. Intraoperative management strategies. 1. Airway management. Ensure appropriate intubation or supraglottic airway device. 2. Ventilation. Maintain adequate oxygenation and CO elimination. 3. Hemodynamic stability. Monitor BP, AR, and fluid balance. 4. Anesthetic agents. Use appropriate induction and maintenance drugs. 5. Neuromuscular monitoring. Adjust muscle relaxants and ensure proper reversal. 6. Temperature regulation. Prevent hypothermia or hyperthermia. 7. Blood loss management. Monitor and replace fluids or blood products as needed. 8. Positioning. Ensure proper patient positioning to prevent nerve injuries. 9. Monitoring. Continuous ECG, pulse oximetry, capnography, and invasive monitoring if needed. 10. Pain control. Use multimodal analgesia strategies. 11. Emergency preparedness. Be ready to manage complications like anaphylaxis or cardiac arrest. Postoperative considerations. 1. Airway and breathing. 2. Hemodynamic stability. 3. Pain management. 4. Nausea and vomiting control. 5. Temperature regulation. 6. Monitoring for complications. 7. Fluid and electrolyte balance. 8. Early mobilization. 9. Wound care and infection prevention. 10. Medication adjustment. 11. Patient education and discharge planning. Special considerations in emergency surgery. 1. Rapid preoperative assessment. 2. Airway management readiness. 3. Full stomach precautions, aspiration risk. 4. Hemodynamic stabilization. 5. Adequate resuscitation fluids and blood products. 6. Choice of anesthetic agents. 7. Temperature control. 8. Monitoring for shock and organ dysfunction. 9. Postoperative critical care planning. 10. Multidisciplinary team coordination. Case Scenario 1. A 60-year-old male with hypertension and diabetes presenting for elective hernia repair. Discuss anesthesia considerations. Anesthesia considerations for a 60-year-old male with hypertension and diabetes undergoing elective hernia repair. 1. Optimize blood pressure, BP, continue antihypertensives, avoid abrupt withdrawal. 2. Glycemic control, monitor blood glucose, adjust insulin, oral hypoglycemics. 3. Cardiovascular evaluation, assess for end organ damage, EC, echocardiography if needed. 4. Renal function assessment, check creatinine, electrolytes. 5. Fasting guidelines, maintain NPO status, consider IV fluids if needed. 6. Medication review, hold ACE inhibitor ARBs on surgery day if indicated. Case Scenario 2. A 35-year-old pregnant woman with sickle cell disease undergoing cesarean section. Discuss anesthetic management. Anesthetic management of a 35-year-old pregnant woman with sickle cell disease undergoing cesarean section. 1. Regional anesthesia preferred, spinal, epidural, to avoid hypoxia and acidosis. 2. Maintain normothermia to prevent sickling crisis. 3. Adequate oxygenation and ventilation. 4. Maintain hemodynamic stability, avoid hypotension and hypovolemia. 5. Warm IV fluids to prevent hypothermia-induced sickling. 6. Pain management with multimodal approach. 7. Close monitoring for fetal well-being. Case Scenario 3. A 70-year-old patient with COPD and coronary artery disease requiring hip surgery. Discuss perioperative considerations. Answer. Preoperative consideration. Intraoperative consideration. Postoperative consideration. Preoperative considerations. Perioperative considerations for a 70-year-old with COPD and coronary artery disease undergoing hip surgery. 1. Optimize lung function, bronchodilators, steroids if needed. 2. Pulmonary function assessment, spirometry, EG if severe COPD. 3. Cardiac evaluation, ECG, echocardiography, stress test if needed. 4. Oxygen therapy if hypoxic, avoid excessive O in COPD. 5. Continue cardiac medications, beta blockers, statins, anticoagulants per guidelines. 6. Smoking cessation if applicable. 7. Plan for regional anesthesia if feasible, reduces respiratory complications. Intraoperative considerations. Perioperative considerations for a 70-year-old with COPD and coronary artery disease undergoing hip surgery. Intraoperative considerations. 1. Careful airway management, avoid excessive sedation. 2. Optimize ventilation, low tidal volume, prevent hyperinflation. 3. Hemodynamic monitoring, maintain stable BP, avoid tachycardia. 4. Avoid high-dose opioids, risk of respiratory depression. 5. Maintain normothermia and adequate hydration. Postoperative considerations. Perioperative considerations for a 70-year-old with COPD and coronary artery disease undergoing hip surgery. Postoperative considerations. 1. Monitor for respiratory distress, oxygen support if needed. 2. Affect pain control, regional techniques preferred. 3. Early mobilization to prevent DVT and pneumonia. 4. Continue cardiac medications and chest physiotherapy. 5. Watch for postoperative pulmonary complications, atelectasis, infection. Summary. Understanding coexisting diseases improves anesthesia safety. Preoperative optimization is key. Tailored anesthetic plans minimize risks. Conclusion. Safe anesthesia requires multidisciplinary collaboration. Individualized patient care improves outcomes. Continuous learning enhances patient safety. Thank you. Questions. Ask me anything. I'll do my best to answer. Don't forget to subscribe, like, and share with your friends.